Welcome to the Higher Power Podcast, presented by Higher Power Sports PT, the show dedicated to helping active individuals like you unlock your full potential through expert insights on injury prevention, performance enhancement, and recovery. Kurt Kessler is a board-certified specialist in sports physical therapy and an athletic trainer. In each episode, he and his guests bring you the latest evidence-based strategies to help you move better, feel stronger, and stay injury-free. Let's learn together.
Welcome back to another episode of the Higher Powered Podcast. Today is going to be an awesome episode. I am joined by Dr. Sarah Neal. She's a doctor of physical therapy, a board-certified specialist in sports PT, and an athletic trainer. It's almost like I molded my career after her, which I did. So we worked together when I was an athletic trainer in Delaware, and she was just starting out as a PT. Then she went on to own her own cash-based practice, and then she was the director of rehab with DC United of Major League Soccer, and now she's the director of rehab for Angel City Football Club. She has presented at national soccer conferences and the U.S. Ski and Snowboard Conference. And the reason she's coming on today is to give us a little bit of perspective of life working in pro sports, her approach to in-season rehab for pro athletes, and goals of off-season training programs. So, like I said, I met Sarah when I started out as an athletic trainer. She was one of my go-to PTs to send my athletes to because she was just so good. And it didn't take me long to realize that this is someone that I need to emulate if I want to get better at what I do. She is one of the best to do it, and I'm happy to have her join us today. Sarah, welcome.
Kurt, you're making me blush, but you told me you would do this.
I did tell you. I gave you a warning.
You did. I'm so excited to be here. I'm so impressed with everything that you're doing with your business and this podcast. I am honored for the invitation, so thank you for having me.
Okay, so I mentioned kind of your path a little bit, but from your perspective, what was the road that led you to where you're at?
Sure. So I decided pretty early after playing sports in school and getting hurt and working with my AT, and that's a lot of people's path into sports medicine, athletic training. I really just loved the setting and loved the education around it. And so I decided, and this was back when the athletic training degree was a bachelor's degree. I decided to use that as my undergrad major. And so I did athletic training as my bachelor's, 4 years, lots and lots of sports experience. And right about when I was graduating from my athletic training degree is when the NWSL had started. And it was so small and was barely forming a league, was threatening to shut down every turn. And so that was kind of, other than our national team and our World Cup exposures and all of that excitement, I just kind of knew then that if the opportunities were there, women's soccer was where I wanted to end up. And, playing for years and years through high school and for fun in college, I just knew that if I was going to go into pro sports and everything that came with it, more than likely soccer would be my sport. So I went into physical therapy school, did everything I could to stay fresh. I worked per diem athletic training all through school, coming out of school, even with my first few jobs in PT in the clinical setting. And so I just knew no matter what, I wanted to stay near the sideline because I loved it so much. And then spent a few years in the regular PT clinical setting, getting reps, treating a lot of patients, high caseloads. Knew really quickly that was too much for me to be able to use the depth of my skill. And so that's when we decided to open up our own business while we were still in Delaware, and enjoyed that for 2.5, 3 years. Had so much fun, was able to actually treat athletes in a more holistic way across the board for performance, for sports medicine, for rehab, for nutrition. And so I was able to develop quite a few skills that actually helped boost me up to work my way into the pro setting. And so when the DC United position came up, I knew that as difficult as it would be for me to be moving across the country from my husband, who was working on a postdoc in Colorado at the time, I knew it was something I had to take. And so I moved out there, which was back home for me on the East Coast. And I worked with the men's team, even though I knew still the women's team was my major goal. There were far more teams and far more opportunities on the MLS side at that time. I mean, as of right now, they still have twice as many teams in the league than the women do, but we're still growing. So that was my first role, and there were many challenges that came with being kind of the only female on a medical performance technical staff in the men's league. And I loved it for so many reasons, and I was able to provide things that male athletes hadn't seen really before at that level. And so I really loved it for what it was, but I just knew that when this opportunity came up at Angel City, it was the perfect role for what I enjoyed and what I was really focused on with my expertise. And so I applied, I got the job, moved all the way back across the country, and things were really working out nicely because my husband had also gotten a position at Cal State Fullerton as a professor. We were lucky to be in the same state at that point, so it all kind of fell together. And yeah, we've been out in California. We are just getting into the regular season for my second season with Angel City. So yeah, I've been back and forth across the country about 4 times in the last like 5 years. So it's been wild, but so fun and so interesting. So yeah, that's kind of the road that I took. And there's plenty of things that helped me get there, but I think the biggest one was being very, very diligent about maintaining my skill set, my athletic training, my sports medicine skill set, while I was continuously developing my expertise in rehabilitation. And that kind of landed me in a role where I could do a little bit of all of it, but with definitely a concentration on the rehab side where I am right now.
Yeah. You said something that resonated with me. It made me feel better about what I'm doing now. And you said, one, the high volume or the high caseload in traditional PT setting. And then with your athletic background, with your passion for helping athletes, going into your cash-based business because it allowed you to use the depth of your skill more.
Definitely.
I've never thought of it that way, but it is spot on and exactly why I am going down that path as well. So that it just gave me a little validation for what I'm trying to do.
Absolutely. And guess what? It's going to hold you really accountable too,
Yeah.
to have mastery over your knowledge and mastery over your skills, which is sometimes a scary thing, but such an important thing to keep us growing and keep us sharp.
Yeah.
So I think the challenge, there's definitely, for those of you that don't know, there's big challenges that come with owning a business and going into cash pay for sure, but they're the right kind of challenges and they're well worth it. And they give so much more opportunity for growth. It's amazing.
Yeah. Okay. So I know the answer to this because I've talked to enough people that work in pro sports, but for the average person that doesn't know much about life in pro sports, I think the perception could be like, oh, that, there's $1 million budgets and everyone, makes so much money and you get to work with pro athletes and it's awesome. And I'm sure it is awesome, but can you describe life working in pro sports?
Yes. And as I'm sure you know, speaking to probably enough people that you've spoken to, it is, I think, no matter what setting you're in, whether it be the highest paid team in the NFL or the lowest paid team in a league that's newly formed, you know what I mean? It's no matter what, it's not as glamorous as it seems and as it sounds. And I think almost anyone in pro sports will tell you that for sure. Um, and I think unfortunately, the women's game does look a lot different than the men's game in any league, in any sport across the board. Luckily, we've seen such impressive growth in women's leagues over the last couple of years, and that's only going to get better. We just this season moved into I don't want to call it a new facility. It is an older facility that the Rams were utilizing before we got there, and so it's huge. It has great space, and that's what we needed. But we came from 2 little trailers and a tent. That was our gym last season and the seasons before. And even before that, we didn't even have a home for the first half of our first season at Angel City. And so that is what like starting in the league has really looked like. And if you look at some other teams across the league, even that are years in, even they still have, temporary buildings and they have to drive 15 minutes to even get to their gym facilities. And so it looks, again, it might look a lot more glamorous than it really is. And I think it depends on the team you're with. Angel City is a a big brand. And so we are lucky enough to have a lot of income. And now that we have a brand new space, we have lots of tools and technology and toys and staff, which is a great thing too. And so I've now worked on the men's side with very little staff, but still good facilities. And then now with a big staff, which changes a lot of the way that you work. And so it's crazy just how different and unique that can be from team to team. So for those looking into pro sports, you got to know those things before you go in, because that's really going to dictate a lot of what your day to day looks like. But I think no matter what, in pro sports, there's just such a high demand on your time and on your energy. I mean, we worked 60, 70-hour weeks for 8 weeks straight for this past preseason. And mind you, a lot of that was just moving into a new facility and then everything that came with it, with the growth we're trying to have and the new staff and the new team members we're trying to have. And so that is something you need to know about yourself going into pro sports is, are you the type of person that is willing and able to give that much time and energy to your career and your job? Because that's huge, especially if you are someone on the staff that travels regularly. I am very lucky to not be, because for me, I know that that would take it out of me. I couldn't be traveling every other, pretty much almost every week or every other week. And for me, I need just a touch more consistency in my schedule and, the bed I sleep on. And so in my role, I stay back with our rehabs or players that haven't rostered and are staying behind. And that works really nicely for me. And I have a colleague, we have another physical therapist that works in our staff who loves to travel, wouldn't want it any other way, thrives in that kind of environment and that on the go type of environment. And she loves it. And she would be probably bored if she stayed back and stayed home. And so you have to know a lot about yourself if you're going to be looking into certain roles in that setting. But no matter what, it's fun. It's exciting. It's kind of like I described before. You go from, potentially a huge caseload to, or if you're an athletic trainer in the college setting, lots and lots of athletes, to a really intimate, maybe 28-person roster where you get to have opportunity to put a lot of depth into what you do and what you offer the team. And especially if you have a pretty decent staff where everybody kind of has their role and their expertise, you really get to own one or two things. We're hiring right now, so I am playing a few roles at the moment, but I actually find that to be kind of fun. I actually have always kind of liked being a part of a slightly smaller staff, so I've learned to kind of adapt with what the needs of the team and the staff are. So regardless, you have to be understanding of the type of time and energy you have to give, and also you have to be adaptable. If you don't adapt, you die, right? Like there's new GMs, new coaching staffs, which of course are going to dictate how your day to day and how your role is going to work with the team. There's whether it's, new team members that need training, need help, whether you're low on staff and you need to take on other roles, you have to be able to adapt to those things to make sure that the team and the players get what they need. Because arguably, I mean, that no matter where you are, that's the most important factor in pro sports and what you do is that the athletes, the players, the team gets what they need so they can do well, so they can thrive, so they can win, because that's the culture that we live in, right? It's about what you produce. So those are all things that I know I learned along the way and was some prepared for and some not so prepared for. And again, you have to be one of those flexible, adaptable people if you want to do well in this setting, for sure.
Yeah. You had mentioned some of the time commitments, 60, 70-hour work weeks at times. I know I've listened to some people in Major League Baseball and NFL who are at some points of the season putting in 90 to 100-hour weeks.
Oh, yeah.
And it's just what it calls for because of the stakes involved. So
Definitely.
Yeah,
and there are leagues in sports that for sure are way worse than what we have.
Yeah.
And what did I used to hear? Some of my buddies in the MLB would they'd have cots. They'd sleep there. For sure, they'd sleep there. They'd have to sleep there. They couldn't take the time to get home and go to bed. So that is definitely a reality. And you just got to know that going in,
Yeah. So I want to talk a little bit about managing some in-season injuries. So talking specifically about acute injuries, things that happen on the field or in training. How do you determine the timeline that someone is going to be out? Are there any factors beyond normal tissue healing timeline that you guys look at?
Sure. In the pro setting, there definitely are. I think In this setting, you have a lot of other stakeholders at play. You've got people's contracts at work that you have to be aware of. You've got the needs of the coaching staff and the team that shouldn't, but do sometimes dictate the timeline of coming back from an injury. And it's honestly, it's just more of a in-depth and intricate management of an injury more than it is like you're not putting anyone in harm's way. But if someone could potentially be available for 10 minutes, that's the difference between winning and losing a game sometimes, depending on the player. So I think the role of that player on the team will absolutely go into that decision. Maybe not initially, but as the rehab goes on and depending on how the rehab is going, that might change a little bit on the tail end, depending on what the needs are for the team and the caliber of that player. I think I think there's also a big role, especially on the women's side, with psychological readiness. And I don't say that in that on the men's side, there isn't any psychological challenges. They look extremely different. I think on the women's side, female athletes there's a bit more self-preservation there, and they know that their careers are so important that they don't have the same things waiting for them on the other side of retirement that these men do. And so I think because of that and where the women's game is, there's a lot more psychological challenges that go in around injuries and what it means for them and their longevity. And not everyone realizes that, how stark of a difference that can have between the men's and the women's leagues. Whether it mean like, oh my gosh, they're at the getting to the end of their contract and they're having this injury. And now this is more of a long-term thing than a short-term thing, more than a short-term knock, but they are always thinking about those things. Is I have to get back and I have to get back healthy so that I can get picked up for another contract because I don't have these big policies and payouts and things waiting for me on the other end of these. So I think those are stressors that you have to be aware of in both sides of the game, men's and women's. But I think on the women's side, it just looks a little different, and sometimes is a bit of a heavier weight for those athletes. But I think those psychological readiness, again, it's important on both sides and across the board. It just might look a little different. So you have to have a good level of awareness, and you have to know your athletes really well to really be able to tell how much anxiety is at play when we're talking about returning, whether things are going well or not well, and how that might change how your rehab looks. And I don't mean the physical part of your rehab, more than likely the mental, psychological side of your rehab. So it's all those little things that I think play a big role. We make our timelines primarily on healing timelines, but if we just know an athlete is a slow healer or a very highly anxious athlete around injuries, we will typically change the timeline a little bit based on those things. And you got to know your athletes to be able to make those decisions.
And I mean, one big thing that I'm working with and incorporating into the patients that I see is stress capacity and basically
Mhm.
the biopsychosocial model.
Absolutely.
And so when you add the weight of contracts coming up or playing time decisions or whatever, I mean, everyone that you're working with is a high level athlete that has pride in their ability to perform. If they're a starter, they want to get back so that their spot's not given away. So like
Mhm.
being mindful and aware of all these extra stressors that do play into the recovery process. Yeah, I could imagine that would be something that would be on the forefront in your setting.
For sure.
For an injured athlete, what does their responsibility look like from your end? Like, what are the expectations on them? What does the journey look like for a pro athlete on the recovery side?
Sure. So you can imagine there's every modality, supplement, specialist like under the sun. Well, it depends on the setting. We just talked about that. Depends on the team. For the most part, they have everything they could possibly need to optimize their recovery from an injury. From our standpoint, from a staffing standpoint, we usually jump on things pretty early as far as supplementation, nutrition, like less than an hour, you know what I mean? After something's happened, we already have our gears going as far as like, okay, you're going to take this and this home. You're going to take this at this time. We're going to recommend this compression modality. We're going to recommend this. So we are on it pretty quickly so that we don't miss any minutes as far as getting that athlete as good as can be by the time, let's say it's a game day, by the time they're back in, 24 to 48 hours later. So we are on top of that pretty quickly. Now, it is the athlete's responsibility to now take on that, be an adult, take our recommendations, and they don't always do. They might have someone they might have a guy, and everybody's got a guy, but they might have somebody that might have a different recommendation for them, right? And so you just hope that you do hold the trust of your athletes, because we can provide everything under the sun, but if they don't utilize it, if they paying enough attention, if they are, and it's not really an attention thing, it's more about whether they really feel it's going to help them, or if they feel their body can take care of themselves, those kind of things, that dictates whether it actually happens. We usually have everything ready and available. It is then the athlete's responsibility to take that role, take that very seriously, those first 24 to 48 hours, because it can play definitely a big role in how the rest of that injury and that rehab looks too. We definitely have expectations of them on their nutrition, hydration, supplementation, and typically we give them those supplies and those guidelines. But again, it's on them if they're going and getting takeout every night, or if they're going and straying from the plan. We really don't have control over it, which is hard. We can just make the recommendations and check in on them. And then it's also their expectation to be in there getting treatment at the time that's dictated, to make sure that they're doing their physical work, their mobility work, their effusion control, all that stuff, both in and outside of our facility too. So for the most part, we try to give them all the tools that we can, and we just do expect and hope that that they take care of their part of things. But for the most part, and we're very lucky, we do have every modality you can think of. Fantastic dietitian that we work with, that we contract with, who has given us lots of protocols and is kind of on call for athletes in that standpoint if they need something specific. So we have a really good team that's able to optimize that process.
That's awesome. So now shifting gears a little bit to more like chronic injury management. So before we were talking about someone's playing, they roll their ankle, whatever. Someone's playing, they fall and sprain their wrist. I don't know. As far as chronic injuries, dealing more with either pains that players are coming into the season with, or things that develop over the course of the season that, may or may not be enough to hold them out. Mm-hmm. What is the focus in the pro setting? What is the focus when you're managing chronic injuries in season?
Yeah, it's every team has them for sure. It's very individualized. It's very dependent on the athlete. It's very dependent on the injury, of course. And a lot of these players that have been in this league long enough, almost everyone's picked something up, So we don't usually jump to training modifications right away, because that does have a big toll on what a training session can actually look like. And if we have 5 to 8 players that need specific modifications, it's really hard to program training sessions and plan training sessions based on bodies if that's the case. So we absolutely will modify training loads, but only if it's absolutely necessary. Because we also don't want to make sure that we want to make sure athletes don't miss out on maintaining chronic loads and staying as fresh as they can. But obviously, we know that we could cause more harm than good sometimes if we're not meticulous about that. So we try to have them do as much as they can do, but we certainly have athletes that have had really, really complex rehabs and return to plays where we're well aware that athlete might be modified, in some capacity for a whole season. And so we are prepared for that, and we have systems in place as far as, that athlete's going to do almost all of the training session, but they might switch off reps in this particular drill. And so we can help manage loads that way. And sometimes it's just enough to get what we need where that athlete stays healthy and for the most part pain-free, but can still maintain loads and be ready for matches and all that. Other than that, we really, really do harp on things like corrective exercises, which for the most part, the medical staff will prescribe for the athletes, and they take that and they do that independently before every training session, and are monitored by our performance staff in that standpoint too. We typically, we have windows and 4 fantastic clinicians that we do treatments every morning. So for that more chronic injury athlete that knows that, we have to make sure that these biomechanics stay good, and we have to make sure that talocrural joint stays moving, or else we're going to see some patellofemoral pain. And so things like that we know about our athletes, we'll stay on top of them for that for the most part, but we try to create as much independence in that realm so we can kind of focus on the more acute injuries and the acute managements when we can. So we have some strategies around that. And then same things, we we are still harping on recovery, on nutrition, on sleep, on all the really big rocks in that standpoint, because we also know in chronic injuries that plays a huge role. And we know pain is worse when sleep is poor, and we know pain is worse when stress is high. And so we almost never back down from that standpoint, because we know that that can kind of make or break an athlete's recovery as well as the maintenance of a chronic injury. So yeah, we're very much on top of that too.
I love that you mentioned maintaining their chronic workload. And for those listening that are not as familiar with that, so for example, say you're a runner and you have an injury and you stop running for a few weeks, and then you go to pick right back up at the same mileage that you were at before, it's a lot harder adjustment for your body to go from that time off back to your previous workload. So like one thing that I have been working on more so with runners is being mindful of their chronic workload when prescribing that graded exposure to whatever movement or whatever activity that they're doing. So I just thought that was an awesome thing to consider, especially with the athletes that I'm working at the high school right now, just being a little bit more mindful of their chronic workload in season, because that's a little different for me.
Yeah. And that's not just on the pitch or on the track, that's in the gym for sure. And like the last thing you want is to lose total body strength and cardiovascular fitness. So you have to get creative with ways to maintain that under, in an injury process. And like I said, we're very lucky to have a lot of different gym equipment, tools, toys that we can kind of utilize that for, which is amazing. But your best weapon for having somebody come back quickly but still safely is to make sure that they don't lose anything else in the process, and be very diligent about regaining in the right way, whether it be just load reintroduction, those kind of things, some of those more direct issues surrounding an injury. So whether it be calf capacity for an ankle injury, or someone that's been in a boot for much longer than you'd prefer, then you have to understand that, tendon capacity might have changed a little bit, or foot intrinsics may have shut down a little bit, things like that, that you have to make sure are reintroduced appropriately, ideally without losing any of the other stuff. Super key. Yeah. And that's part of what my whole job is. And part of our performance staff is we program for our injured athletes very specifically. They have far more gym sessions than our active on-field athletes are going to have for that exact purpose. And then we just close that gap as they get closer to getting back on the field and are spending more time building that more technical capacity.
Yeah. It's whether you're a pro athlete or someone who just loves to go to the gym or exercise or whatever, like there are all these things, all these components to making a safe and healthy return that if you don't have someone looking at that, you would never know. And that's how these injury cycles go. You get hurt, you start feeling better, so then you return to what you're doing, get hurt again, and it's just this cycle unless someone is helping guide you through that. So again, whether you're a pro athlete or, someone who just likes to play recreational basketball, like the human body is the same no matter what level, but there's just some different considerations. Now
guidance is key, like you said.
Yeah. You started talking about this a little bit, but I want to dive a little bit deeper into recovery. I feel like this is one area, especially in the high school sports or even college sports, that is overlooked. Like very overlooked is recovery. And I don't know that everybody knows exactly what goes into recovery. So from your perspective or some things that you work on with your athletes, what are some recovery strategies? What are some things that you look at? Do you do any kind of data tracking with them? What does recovery look like at the pro level?
Sure. So for those that maybe aren't in our setting, the flashier things that you might see on social media, on the internet, or like seeing what these pro athletes are doing are things like the recovery boots, massages, cupping. BFR is a big one, which I'm actually a huge fan of. But arguably, if you're not hitting the big rocks of recovery, are sleep, nutrition, stress management, which I can't harp on enough, hydration. If you're not hitting those, the rest of them don't even matter. You could do every modality under the sun and it won't it'll maybe help you 3%. But if you look at the other 97, it's those big rocks that I just mentioned. So no matter what, before I even will talk to an athlete, a young athlete, about recovery tools and modalities, I am really focusing on those bigger aspects. Sleeping, a huge one, especially for student athletes, and stress for student athletes for sure. And we still have student athletes on our team. We have young U18 players that are still doing online schooling, or people that are taking business courses just because they want to, those kind of things. Like that still happens. I have athletes that are non-English speaking that have to take English classes, as part of their contract. And so if they're taking those at 10 o'clock at night, that's a big problem. So I'm for sure checking those big boxes first when I'm talking to these athletes about recovery. So no matter what, the flashy stuff is nice and also expensive, and that's something to
Yeah.
keep in mind. And we have we have every tool under the sun. We have a float tank. We have so many things that we can offer our athletes. But other than those big, like 4 or 5 things, I personally feel that all those other modalities and those other options are very personal. So I have athletes that love to use the BFR for its recovery protocol, and some that it just doesn't do anything for them. You know, and so we offer as many things as we can, but we try to personalize them based on what that athlete feels best with. So unfortunately, we don't have a pool within our training facility, but I have athletes that love to go home on their off days and do pool recovery. So I'll write programming for that specifically, and they'll just go and do that on their own. So I would say it's very personalized, and it's very based on what your resources are. But otherwise, we use a lot of pneumatic compression shorts and garments. We have obviously the BFR units, the Delphi units, which are wonderful. We also have BFR shorts, which they can take with them. They can utilize in the pool, out of the pool, passively, actively, which is kind of nice because that lets them personalize and use a bit of the BFR technology at the same time. We have we have specific programming for mobility routines, for bike routines on their off days. And so we have so many different options and programmings that we can offer. But like I said, we try to personalize those things based on what an athlete will do, and also what they like to do. Because if they don't like to do it, then it's not going to get done, especially not on an off day. So I would say you got to get the big rocks. You got to be sleeping well. You have to have strategies to manage your stress. And that's a lot easier said than done for certain athletes that either don't have resources for psychological management or therapists or sports, therapists. And even just having other stress relievers like walking, being in nature, meditation, journaling. Again, very personal, but still have to have at least one strategy for that, one effective strategy for that. So recovery can look like a lot of different things in the pro setting, but those big ones are the most important. And then from there, we let the athletes kind of choose what they enjoy doing and what feels the best for them.
Yeah, it's fun for me to nerd out a little bit and like hear what the pros are doing or what resources you have at your disposal. But you said it best. If you don't hit all the core pieces of recovery, like that other flashy stuff doesn't matter. And if whether you have millions of dollars to spend or nothing, like the core stuff is all stuff that is cheap and you can control it yourself as the patient, as the athlete.
Yes.
Sleep, nutrition, hydration, and stress. Like that's all stuff that you can do without, millions of dollars. So
Exactly.
that's awesome.
And one thing I will mention from nutrition is tricky because you really need to, for nutritional guidance, and then there are some medical professionals, PTs, ATs, that have some nutritional knowledge. But if you're a young athlete and you're very serious about your sport, about your role, about where you want to go with your sport, I highly, highly recommend finding a well qualified dietitian, sports dietitian, who is well versed in elite sport and what that actually means and what that looks like. Because from a nutritional standpoint, being one of the big rocks, that can either look really good or really bad, depending on the type of consultation that you get. So I highly recommend, even if it's just a one-time consultation, to see like, hey, what are the big supplements that that I should be taking for my recovery. And that I think can go a really long way. Or even just getting a little bit more of a bespoke or specific nutrition plan that will fit you best. And because we talk about things like, I mean, protein's huge. That's proven. That's across the board. But other supplementation, again, might work for some, but not others. We have everything you can imagine, but some athletes, if they don't like it, they won't take it. So I think at least having the consultation and the education on that as an athlete is really key. And making sure it's coming from a very credible source, I think is really important too.
My wife is a dietitian, and not in the sports realm, but
Mhm.
nutrition is something that I've learned how important it is. So anybody in the central PA area here, I do have a few good resources that I've come across in my athletic training career that can be helpful. All right.
Amazing. Yes.
Heading towards the home stretch here.
Mhm.
You've played a couple different roles in the last 5 years, whether it's staff PT, business owner, now your roles in professional sports. What is something that you've learned in the last 5 years that has changed your practice or the way that you look at treating athletes?
Yeah.
Of all
There's
all the
definitely,
experience
I
that you've had,
know.
give me one thing.
There's a lot of things I could say, and there's a lot of more like hands-on tools that I could say for sure. But when you talk about impact as a clinician, the biggest thing I will say, and this isn't necessarily something you take a course on, unfortunately, this is something you really have to grow and develop, is how important the role of emotional intelligence, empathy, the soft skills that might not be highly looked upon or valued in certain settings in the pro setting. I have actually found that that's been my biggest tool, my biggest superpower for compliance from athletes, for trust. And for me, in my role, I primarily handle the really brutal long-term injuries. The traumatic ones, the ones that are extremely difficult and rocky and almost always involve some form of just psychological challenge, and huge emotional tolls. And so I think no matter what, every clinician should have these tools in their toolbox. But for me, it's a non-negotiable. If I'm going to bring someone through a really brutal 12-month ACL rehab, I got to have the trust. And it doesn't matter how long it takes me to build it, but if I never get it, it's going to be that much harder. And so I think I've always had those skills, and I actually developed those skills not in the pro setting. I developed those skills when I was working with spinal cord injuries. And, when I was in school and I was working with these patients that had just really traumatic experiences and really just awful things happen to them and are placed in these extremely vulnerable positions. And it's your job to build confidence to help them get better. And like I said, I didn't pick that up in the pro setting, and it's not always very prominent in the pro sports setting, but I will just recommend to anyone that either wants to go into sports or just wants to be amazing at their job, don't take for granted some of those softer skills that you develop in settings where you might not want to stay in that setting. You might not want to work in a hospital, but you're going to meet a lot of people, and it's going to be your job to build their trust and get their confidence in you, to do your job well. And so when I joined DC United in the men's league, I learned very quickly that that was something that wasn't very present in the men's game, that empathy, that focus on making sure that they're listened to and they're heard and they're treated like a person and not just an asset, not just an athlete. And so I think it just goes a really long way. And I built trust extremely quickly in a setting where maybe if it's a little tougher for a female to really get confidence from the male athletes, I think that was kind of my biggest tool and my superpower. So don't take for granted those smaller, not even smaller, they're big, those softer skills that you might learn in other settings, when you're dealing with a variety of people and a variety of personalities, because they go a really long way when you're in this higher level, more elite setting. Because there's a really stark difference between the professionals that have only ever worked in elite sport with elite athletes and those that may have had a more diverse background, leading into this setting. And I think every team needs both. but I think you'll be amazed how crucial that is in this role, especially in a role like mine, where, like I said, I'm dealing with some really challenging stuff, and it's my job to help athletes manage not just what's going on in the training facility and with their injury, but all the other factors that are going on outside of that. And that is an absolute skill. And I wouldn't say there's like I said, a course or a book or anything in particular I would point you to, but I would just say, but they're out there. They are. But keep that in mind that that's a really, really crucial skill that might not be on a job description, or, it might not be the top of your list of things that you think would get you to this setting. But they're key for sure.
You could have given me 100 guesses of what you would have said, and that I would not have guessed that. But you could not have given a better answer than that, because it is so true, whether it's pro athletes or, whoever down the street. Like, if someone can't trust you, it's going to be so much harder to get the best out of them and get the best for them when that trust is not there. So just making sure that people are feeling heard and cared about, that it's such a foundational piece. And I'm so glad that you brought that up.
Yeah. And one thing people don't realize in the pro setting is pro athletes have a lot of reasons not to trust you.
Yeah.
They have been in situations where they've been forced to play hurt. They've been in situations where they've just been treated like a chess piece or a pawn, or, and in the women's league, people don't realize how much abuse, how much really terrible things were going on early in the NWSL, in the women's league. And so you get some of these slightly older athletes, more veteran athletes, that they have no reason to trust you. And so building that trust in certain athletes is going to be a lot harder than others. But those are things you might not realize going in. You just assume they're going to listen to everything you say because you're the professional. That ain't it. It's not it. And so that's just, you got to be prepared for those kind of things. And you might not win everyone over, and that's okay.
Yeah.
But I think you got to go in with at least some thoughts and mindsets around in that space, or else you're not going to get far, and you're going to realize really quickly that that you're going to hit some barriers.
Last topic here. And you did touch on some of these, but I just want to wrap it up into a nice little bow for anybody who's thinking about this type of career, or even just athletes who are listening to this. What's your advice for someone who hopes to work in pro sports someday?
Yeah, I think what I mentioned a little bit before about developing those interpersonal skills and those, emotional intelligence type of skills is key. I think, and that being said, I think making don't be in such a rush. Make the most of the time you are spending in other settings, building your skill set. As brutal as it is working in the more traditional clinical PT setting, that's where you get the reps. And that's where you see some of the wild stuff and the challenging cases. And so don't take that for granted, and try to learn as much as you can from those settings, because you are expected to have seen a lot of those things and have answers for those things, and have a high level of experience and expertise for the most part, by the time you get to this setting. So keep that in mind, is that every experience you go through likely has some deep value in it. So keep that in mind. Don't be in such a hurry to rush your second year out of school into pro sports, because when you get there, you are going to be in such a niche, and you're going to be doing things you probably wouldn't expect to be doing. And so that is not the place to build your skill set. And that is not the place to build your expertise. So I try to make sure people keep that in mind, because I hear students coming out of school, not even out of school yet. I want to work in pro sports, and I want to know what I can do right now so I can be in pro sports as soon as possible. There's a lot you can do for sure, but also, like, find mentorship, find experiences where you can build, where you can make mistakes, and you can build that expertise without having so much pressure on yourself in the pro sports setting. So that's a big one. I think that's huge. And I think people don't always realize that. The other thing I'd say, and this is something I, as an introvert, have a lot of trouble with, but you got to network, and you got to do it the right way. You can't just message someone on LinkedIn and say, "How do I get your job?" I'm going to ignore that message. I'll probably delete you too. So keep that in mind. I think do it as organically as you can. Go to conferences, and do your research on speakers, and do your research on who's going to be there and what the topics are going to be, and get good at meeting people and asking about their experiences and not just like, how do I get the job? Because we're exhausted. We don't want to hear it, but we are willing to help. My colleagues and I will go way out of our way to speak to especially young females that want to get into sport because there haven't been a lot of opportunities, until now. And they're still hugely outweighted, men versus women in professional sports. And so my colleagues and I take a lot of time to have those conversations with professionals and clinicians that are looking to start that route, and what we've learned and what we recommend. And so just make sure you approach, people the right way and do it organically and do it with curiosity, ask questions. And at the same time, like in those conversations, make sure that this is the right role for you, the right setting for you. Make sure you know a lot about yourself to really make the decisions, because you'll talk to a lot of professionals that they get into pro sports, but a lot of people, they're not here 10 years, and there's a lot of reasons why. So good and bad. But I think those are your opportunities to get to know people and network the right way and take the time and kind of play the long game. Because I think that goes a really long way, because eventually people will come to you when they're looking to fill roles instead of you really just, having to do all the work. So keep that in mind. I think networking, when it's done correctly, can be extremely valuable. I think those are probably my biggest pieces of advice.
Advice for athletes wanting to train or be treated like a pro.
Yeah. There's a lot of misinformation out there.
Sure is.
A lot. Oh boy. And that's like half our battle, is trying to, to battle misinformation. And even our pro athletes that have been in the game a long time, it's amazing some of the things they'll come up with by the time they come and see us. And so I think as an athlete, do your research. Find someone who is experienced, who can give you kind of honest answers, not just quick fixes, but honest answers about things like recovery, injury management, rehabilitation, performance, those kind of things. Look for clinicians that have a bit more of a holistic approach. The big thing, you got to watch out for the buzz stuff. You got to watch out for the ones that have the quick fixes, the one track, answers to everything. You gotta be very aware and smart, and you have to be looking for someone that's willing to individualize their approaches to your care, for what you need, because that's the whole point. You're a different athlete than the person next to you, so you really have to make sure you are finding trusted hands. And that's not easy for someone who might not know a whole lot, about the different fields and the settings. And so do your best in that capacity, but you'll learn pretty quickly that there are clinicians out there that are really out for your best interest and looking to help you as a whole athlete. So keep those things in mind, I think. And then other than that, like we talked about through this whole podcast, you have to be taking things like your recovery and your nutrition very seriously. Those are overlooked, and I say that from a younger athlete perspective. How would you know that unless someone were already kind of in your world teaching you about that? So if you don't have someone like that, seek someone like that out. Because if you can start to learn these recovery and these nutritional practices early, it could completely change your game and the length of your career in athletics. And that's huge. Yeah, I think that's my biggest thing and that's tough. But I think someone like you, Kurt, like in your setting where you have a wealth of knowledge and you have talked to people and taken courses and really done things to build up what you can offer an athlete, that is immense. And understanding that you don't, clinicians that have all the answers probably aren't the clinician for you, but the ones that are willing to help guide you in the right direction, even if that means in a different direction, those are probably the ones you can trust. And that's always how I've tried to work with my athletes and my practices too.
Thank you for saying all that. And I say it that way because as you were saying that, the thought that came across my mind was, you know how sometimes your parents will say things a million times and then like your aunt or uncle will say it once and it's like, oh, that's like,
Yeah.
That's how I feel. Like,
Yeah.
you're the aunt or uncle that I just need other people to hear it from someone other than me.
Yes, it's an art for sure. Yeah, I know. And that's everyone. I could say something to my athletes a million times, but if the performance coach they love and trust, says it,
Yeah.
then cool. Then I need you to be the one to say
Yeah.
it. That's fine. Yeah. Oh, that's so funny.
All right. Well, that's all I have for you today. Let me just say to you, I know that you might not realize it because you're just living your life and, going through the things that you need to do on a daily basis. You as a resource for myself and anybody listening, my gosh, is there anybody better to talk to and get guidance from than you? So thank you from the bottom of my heart. You are like right there on my Mount Rushmore of PTs that I've ever known. Just thank you so much for coming on, for sharing, for giving me your time in the middle of your season. It's just an incredible honor to have you on here. And I just appreciate your friendship and your mentorship. So thank you.
Well, Kurt, you are very, very kind. And I'm so glad to even be able to help and give guidance. And I know I've gained a lot of experiences over the many years and the many settings that I've been in. And I think what a cool thing that you are doing to provide some outreach to listeners and share your own expertise because you've got tons that you can offer, Kurt. And I think it's such a really cool thing that you're doing. So hey, like I said before, I'm extremely honored that you even offered me a voice and hopefully I said some things that people can take with them. But as much as I'm terrible on social media, I still do love to connect to clinicians that are trying to build things for themselves and for their athletes. And so please feel free to find me on LinkedIn and connect and have a talk and have a conversation. Yeah, and I had a great time. Thank you.
All right, that's going to do it for this episode of the Higher Powered Podcast. Another thank you to Sarah Neal for joining us today. If you want to connect with myself or with Sarah, feel free to go through me. You can find me on Instagram at Higher Power Sports PT or my email in the show notes. So thanks for joining us, everybody, and we'll see you next time.
That's a wrap for today's episode of the Higher Powered Podcast, presented by Higher Powered Sports PT. We hope you gained valuable insights on how to stay strong, move better, and prevent injury, all backed by expert knowledge in sports physical therapy and athletic training. If you enjoyed today's episode, don't forget to subscribe, rate, and review. Your support helps us bring more evidence-based tips and strategies to active individuals just like you. For more resources or to connect with us, head over to hpsportspt.com. That's hpsportspt.com. Remember, you've got the power to perform at your best. Keep training smarter, recovering faster, and living stronger. Just a reminder that the content shared in this podcast is for informational and entertainment purposes only. It should not be considered medical advice. Always consult with a qualified healthcare professional before making any changes to your health or treatment plan. Thanks for tuning in. We hope to see you next time on the Higher Powered Podcast.